Taking one very common pill daily for just 12 months may raise your risk of dementia by 50%. But it's not just one pill. It's actually a group of medications known as anticholinergics. A few examples are benadryl, tylenol PM, and hydroxyzine used for anxiety. There are, however, several other everyday medications probably sitting in your medicine cabinet right now. Allergy pills, sleep aids, anxiety meds, bladder control drugs. In a moment, I'll let you know if you're taking one and safer alternatives you can use instead. There's strong evidence from multiple large studies showing these medications are linked to brain shrinkage and memory loss. Hi, I'm Dr. Air, integrative psychiatrist and lifestyle physician. Quick story about Linda. She's 62. She came to me because her memory was sleeping. She'd forget appointments, lose a train of thought mid-sentence, walk into a room and have no idea why. She thought it was stress, hormones, or just getting older. But when I reviewed her medications, I found the real culprit. It's a very common medication that most people take. I'll share this in a minute, but let's talk about anticholinergic medications some more. So what are anticholinergics? That's a fancy word that means they block a brain chemical called acetylcholine. Think of acetylcholine as your brain's spark plug. It helps neurons talk to each other. It's essential for memory, attention, learning, and even muscle movements. When you take these drugs long term, it's like throwing a wrench into your brain's communication system. The signals get weaker and weaker. And over time, that could lead to memory loss, confusion, and even predispose you to dementia. Here's what makes this so dangerous. Anticholinergic drugs are everywhere. Allergy medications like benadryl, sleep aids like tylenol PM, Unisom, or ZQuil, anxiety medications like hydroxyzine, also called vistaril or Atrophy, bladder control drugs like ditrophan, Ditrol, or Vesicare, IBS medications like benadryl, even motion sickness patches like scopolamine. Some are prescription, many are over the counter, but they all have the same brain blocking effect, and most people have no idea they're taking them. And the research, it's alarming. A systematic review of over 1.5 million people found that anticholinergic drug use is an independent risk factor for dementia and Alzheimer's disease. Another meta-analysis showed that using these medications for 3 months or more increased dementia risk by 46%. 46%. After 3 months of use. Now, I need to be clear about something important. This evidence comes from observational studies. That means researchers noticed a link, but they cannot prove that one thing causes the other. Other health problems may be affecting the results, making the link appear stronger or weaker than it really is. Because of this, different studies have found different results, and the evidence is not yet consistent. But the pattern is concerning enough to warrant serious attention. And here's the part that really concerns me as a psychiatrist. The risk increases with dose and duration. The more you take and the longer you take it, the higher your risk. And here's what really got my attention. One study didn't just look at memory problems. They did brain scans. And what they found was shocking. People taking anticholinergic medications had measurable brain shrinkage. Their brains were smaller, their metabolism was slower. Specifically, they found reduced total cortical volume, thinner temporal lobes, and larger ventricles, all signs of brain atrophy. This isn't just about feeling groggy or forgetting where you put your keys. These drugs are changing the shape and function of your brain. Now, you might be thinking, but my doctor prescribed this. Wouldn't they have warned me? Your doctors mean well, but here's the problem. One doctor prescribes a sleep aid for insomnia. Another prescribes anxiety meds for panic attacks. A third prescribes bladder medication for urgency. But what is the cumulative effect on the brain, especially over years or decades? And this becomes even more critical as we get older, because as we age, our natural levels of acetylcholine already start to decline. So if you're taking a medication that further reduces acetylcholine activity, you're essentially speeding up that decline. You're cutting off one of your brain's main lines of communication. And the longer that goes on, the more damage it causes. Now, before I explain what to do about this, let me be clear about something important. I'm not saying these drugs should never be used. Taking one benadryl for a severe allergic reaction, that's fine. Using a bladder medication short-term after surgery, sometimes necessary. Taking hydroxyzine occasionally for acute anxiety, that's okay. But what we want to avoid is taking these medications every day for months or years, especially when you take several of them. That's where the damage happens. That's where the risk becomes real. So who's at highest risk? Adults over 60. People already experiencing memory issues or cognitive decline, and anyone taking more than one anticholinergic drug at the same time. That last one is more common than you think. I see it all the time in my practice. Someone might be taking hydroxyzine for anxiety, benadryl for sleep, and ditrophan for bladder control. Each drug blocks a little acetylcholine, but together, they're shutting down major parts of the brain and nervous system. It's like dimming the lights in multiple rooms of your house at once. Eventually, everything goes dark. So here's what you do. Step 1. Go through your medicine cabinet. Look at both prescription and over-the-counter medications. Search online or ask your doctor or pharmacist, is this anticholinergic? Make a list of everything you're taking. Step 2. Do not stop any medication without first talking to your doctor. But do ask if there is a safer alternative, especially if you've been taking it long term. Be your own advocate here. Ask, is there a non-anticholinergic option for this? Let me give you some specific examples. For sleep, non-anticholinergic options include melatonin, magnesium glycinate, ashwagandha, or chamomile. If you need a prescription, trazodone has minimal anticholinergic effects and works well for sleep. For allergies, consider second-generation antihistamines like Zyrtec, Claritin, or Allegra. They work differently and don't penetrate the brain as deeply as benadryl does. That makes them much safer for long-term use. For bladder control, ask your doctor about Metabolic, a non-anticholinergic option that works differently. For IBS, peppermint oil could be a great alternative to benadryl. There are also other prescription options your doctor may recommend depending on whether your IBS is constipation predominant or diarrhea predominant. Now, if you've been on these drugs for a long time, don't panic. But you can start optimizing your brain health now. Get regular quality sleep, move your body daily, manage your stress, and reverse other risk factors for cognitive decline like insulin resistance, high blood pressure, chronic inflammation, and poor metabolic health. This becomes even more important as we get older. Chronic stress over years or decades changes how the brain and nervous system respond. And for many adults in midlife, hormonal shifts can amplify these vulnerabilities. Decline in estrogen in women, for example, affects brain metabolism and memory. Decline in testosterone in men affects motivation, focus, and cognitive resilience. That's why protecting your brain now matters more than ever. Here's something else most people don't realize. The effects of anticholinergic medications can create a vicious cycle. You take a sleep aid because you can't sleep, but the medication causes brain fog and memory problems. So you feel more anxious and stressed, which makes it harder to sleep. So you take more medication and the cycle continues. Breaking that cycle starts with awareness and then making small strategic changes with your doctor's guidance. Here's what happened with Linda. She had been on benadryl daily for years. We switched her from benadryl to magnesium glycinate for sleep. We also addressed her sleep hygiene, keeping her bedroom cool, limiting screens before bed, and establishing a consistent routine. She started with regular, moderate exercise and adopted an anti-inflammatory diet. Within a month, her brain fog began to lift. Within 3 months, her memory was sharper than it had been in years. Talking about diet, to find out 10 foods to avoid to protect your brain health, check out the next video.